Lambert Titus Parker. I'm the medical director of Integrative Longevity Institute of Virginia. We're a 501c3 nonprofit medical research institute which promotes personalized medicine based on human ecology. Personalized medicine is something you're all hearing about, and in nursing, they talk about patient-centered care, right? That's all something I'm sure is being drummed into you. It's patient-centered care, quality control, patient-centered care. How do you achieve the patient-centered care in the 21st century? That has been a major question which hasn't fully been answered. Because when you work in the hospital, you have nursing, you have pharmacy, you have nurse practitioners, you have PAs. It's a very segmented subspecialist population. And you're getting orders from everybody. And many times, regardless of how hard we try, the patient gets lost in the shuffle. So I would say in the 21st century, we need to start asking, what is personalized care? What is caring for a human being? Are you caring for somebody with diabetes? Or are you taking care of the patient? And that's a very good question for nursing. Because in nursing, it's not a matter of the diabetes, it's the patient you're faced with. A physician can deal with just a diabetes. Well, you're diabetic, you should do this, here's the orders. But they come to you, they're asking you all these questions, human questions. What do we eat? I don't understand what it is. It's way over my head. And so that brings the concept of what is medicine in the 21st century, and how can we make it so that it's functional. With that, let's get moving. The objective, define personalized medicine, patient-centered care. We'll do that. Identify the disciplines that need to be integrated into this model. What are we talking by identify the disciplines? There are a lot of disciplines. In nursing, it's taking care of patients. Maybe it's giving anything from talking to them. Maybe some touch therapy. A person whose knees are swollen, just putting your hands on the knee and waiting and talking to them, that's a huge therapeutic. Or is it giving them an enema which is needed because they're constipated? Or just being able to tell them, look, we can talk to your family, whom can I talk to, and act in between. You're not being a social worker, you're being a nurse because you are there at the point of care. That's personalized medicine. So we're going to try to bring all that. So what are disciplines to come in? Then when you have a problem and a doctor comes in, they're busy, they leave. It may be up to you because the patient doesn't want to say it because the doctor is up there. So to take the leap and go in there and risk being put down and say, look, this patient really wants this because of this and this, and get your point across. Right, that's part of nursing. It's not it's not a job for cowards because you are advocating for the patient in patient's interest. Then we will discuss the functionality of the medical model which we're talking about. Okay, let's go to this. Now, when you look at this, we're talking about trends of number of cancer deaths among men and women in US. If you look at this, see this. This is in 1930. That was the cancer rate in 1930. Look at the cancer rate in 2000. 2006. Okay, now most of the graphs you see is this. Right, that graph you see from 2000 to 2006. That doesn't look bad, but you look at this and look at the difference. Okay, so historical view, if you're going to look at the new century and decide what should we do different, we have to understand the problem you're facing with. And the problem is something like cancer is just skyrocketing. I mean, that just goes way up. And you can't explain all of that by putting the blame on the patient or putting the blame on nursing or physicians or anything. Something has happened for this to go up. Look at this. Obesity in US adults between 20 and 70. If you look at this area, this is 1960. 1960 to 62. Look at this. This is now. Okay, that's 35.9%. That's close to obesity. In 20 years, that's where we're going to go. Now, no way can you tell obesity just jumped from here to there because people are lazy and ate too much food. That does not happen. Okay, this is a worse statistics than AIDS epidemic or any other epidemic we have. So those are two big things, and that's something which are affected. There's more people today on weight loss program, more gyms out there, more books being published, and yet this keeps going up. So it would behoove us to sit back and say, hold it, that can't be it. Now, this is the idea 20 years ago. You know, if it's such a nice day outside, you want to go for a walk. The fat rat says, nah, I have a chat room meeting at 4, I got to be back here by then. So what does this show? This makes you look like, well, because you're fat, is because you're lazy, your lifestyle, you're not doing what you're doing. In reality, things have changed. We're in the 21st century. What does 21st century look at this and say? Hogwash. This is stupid. It doesn't even make sense in the overall view of obesity. What we're finding out in fields like genomics, epigenomics, and a lot of these research, that you can take, for example, a fat rat and a skinny rat. You take all the stool from the skinny rat, put in a rat which is a fat rat, and the fat rat will become thin, and vice versa. So what you're saying is the gut flora can influence whether they're going to be fat or thin. It's an amazing information. So a fat rat may actually eat less than the skinny rat, yet it's going to put on weight. So there's more to it than just this kind of idea. It's more to it than calling the dietitian saying, you got to only eat a 1,200 calorie diet, you'll be fine. If you're not fine, it's your fault, you cheated. That's the 20th century model. 21st century model is to take other things in impact, which impacts disease, and look at that. And nursing is a great place where you can look at that. When a dietitian comes in and tells the patient, gives you a calorie count, everything, they go, the patient's looking, staring, saying, I don't understand any of this. I'm eating pretty good, but I'm gaining weight. Somebody has to have to tell them, that's okay. That means there's something else may be wrong. You may have something else wrong in your genetics. Your gut flora may be off. There is hope. You just needs to be worked out. Start with this, and then we'll go forward. Nursing, if anything else, is a profession of giving patients hope and compassion and be able to have a human being next to them. That's part of human ecology. Human ecology is humans reacting with humans. Okay. Now, there's another one, the lethality of loneliness. We know now how it can ravage our body and brain. Emotional isolation is ranked as higher risk factor for mortality as smoking. I mean, that's a fact, as much as smoking. And who does better to deal with the loneliness of a patient than nursing? Okay. And for example, in Soviet Union, they adopted a lot of kids where the babies were in orphanages were never touched. And when they adopted those patients in the United States, what we found out was they were totally not like human beings. They were more animalistic. They burned down houses, did things. They just did not know how to connect to people. They didn't have that ability. Because when you don't touch a baby and you don't cuddle it, talk to it, parts of the brain which makes you human get shut down. But even afterwards, as we grow older, when you're lonely, if you're not touched, if you don't get hugs, and now I'm not talking about sex, I'm talking about hugs, simple hugs. Simple hugs, smiles, touch, hand on the shoulder. They all make a huge difference in how the brain functions, how your hormones function. And these are facts of the 21st century. Again, this is something nursing can teach people. Tell them, you need to hug your patients, hug your spouse, hug your kids, even if you don't feel like, or go up to the spouse and say, you know what, you came, you're sitting there for half an hour, give her a hug or give them a hug. Okay? That means a lot. Hold their hands and sit down, not sit out there and watch the patient. Keep your hands on. All those things, they all play a part, a therapeutic part, which is measurable, not just soft touch, all the lights, nice, same thing like yoga or something like that. These are science, we can show that. Now, what's happening right now is look at the information we have on a human being, which has skyrocketed. So we in 21st century have more data than any other century compared to the whole human history. But data does not mean information. So when you go on the internet, you have all this data, and what you have is information pollution, not information. So to make sense of it, you have to take the data sets and give it relevance, give it context. You could say we live in an era now of contextual error. If you don't give something context, it is meaningless. And that's what social media does. It doesn't give context. It is just everybody spewing whatever they want to spew. You as nurses have to get used to giving context to what it is. Or you're just gossiping. And the difference in you being gossiping and being professional is giving the material context. Okay. Times we live. Predictive genomics. What's predictive genomics? Genetic testing. Many of you may even know what's called 23andMe. 23andMe. You can look it up. 23andMe was set by the wife of Google Echelon. Over here she is. She decided to do genetic testing for $99. So you take a swab from your mouth, put it in, send it in. She will send you genetic information for $99. You know, a few years ago it's like $5,000. But it's all data. It doesn't mean anything. It's like an alphabet soup. But you can take that and put it in a different program for $5. I will give you information on it. Are you more prone to arthritis? Are you more prone to Alzheimer's disease? Is medication like methotrexate good for you? Can you take statin drugs? A lot of this information. That is predictive genomics. We can do this now. There is no excuse. Look at our statistics. About 100,000 people die every year of prescription drugs. Prescribed appropriately, not inappropriately. The doctor did the right job. Patient died. Remember, the 19th century idea was the operation was successful, but the patient died. You know, so we are so caught up in protocol. If you do everything right and somebody dies, tough luck. That's just how it is. But today with genomics, we can actually show what subgroup of patients shouldn't get certain drugs. For example, statin. How do you know you should take statin? There's a lot of bad news. Well, do a test. And if the test says you're going to react to statin, don't go on statin. Methotrexate, do a test. If you're on a high risk for side effects by your genetics, don't take methotrexate, go for something else. Aspirin, you can take it. You go to every time you go to a hospital, if you're age of 35, 40, you have chest pain, take an aspirin a day, it's good for you. But 40% of the women, aspirin doesn't work for them. So it gives them false sense of security. They're genetically resistant to aspirin. So you need to know that. So you know that they shouldn't be on aspirin, and if they have a problem, you really have to pay attention to them. Especially women have a higher mortality. Okay. Also, another thing is almost most of the drugs, almost all the drugs really, which are used on women, were never studied on women. They were studied on men and then put on women. But women are different than men in many ways, metabolically, everything else. So that again is a part and parcel of what has to be taken into consideration, which we don't always consider. Okay. Then, genetic food. That's a whole other ball game. Soy. Soy you buy in the United States, 90% of soy is genetically manipulated. You have epigenetics. Epigenetics we'll talk about a little more. Epigenetics is how you are who you are. In other words, all of us in this room, if you look at, let's take all the women in this room, not that many men, all the women in the room, your DNA is 99.9% exact. 99.9, no difference. Yet look at all the difference how you are. Okay. If you take me, my DNA in my brain, my nose, my hands, it's same DNA. But yet, when it expresses itself, I express a nose, eyes, hair, all of these things. So how does that happen? That's the field of epigenetics. How our environment affects us to change a manifestation of our genes as we are. So epigenetics is very important. What we are finding on epigenetics is what happened to your grandmother is going to affect you. That's 3 generations. People who come up in war zones, which we have no idea, like in Lebanon where they are bombed every single day. Generations go by before that can go away. That's epigenetically affected them in many ways. Literally in how large they go, how small they go, the skin color, the mentality, all of those things. And we'll go a little more on it. So a lot of you, I'm told, are very good with smart pads and iPhones. Look up epigenetics. Okay, go to YouTube, type epigenetics. You should know this. Okay. Then, the ability to see biological system and basic components and manipulate them. 21st century, we can actually go into the DNA and start telling you what's happening. If those of you had said, watch CSA, you look at that, there's a blood in the carpet, they pick it up, and remember all the information they can give you. How do they do that? How come we can't get it with 1 drop of blood? Because in medicine, every test has to be done in a different tube, because that's only then can you charge for it. If you did all the tests in 1 tube of blood, it may cost you only about $10, $20. But if you split them up, it may be 3,000, 4,000, 5,000. That's how the system is based. It's neither wrong or right, it just is. Okay? So we are getting to the point, in my opinion, about 10 years from now, 15 years, all you're going to need is something like an Xbox. It'll neatly put your finger in it, it's going to stick that, you put a drop of urine, the genome array is going to look at it, it's going to go in their cloud, come back and tell you exactly what you have, what you need to take.
Oh, wow.
You know, that's probably what will happen. Good news, it'll be 10, 15, 20 years, so, you know, we will still go make money and not be out on the streets.
Yeah.
Okay. Paradigm of signaling without ecology, within ecology. Paradigm of signaling, it's something which is very dear to me. Signaling is when you're talking about it, I'm talking to you, you're listening. That's signaling. I'm talking, you're hearing. Okay? But at the same time, if you're jittery, you want to be out of here, you've got saying, what the hell am I listening to this guy for? You're having internal noise which is talking to you. There's always crosstalk. Crosstalks in everything. And that's what makes life. Crosstalk, the signal. And signaling can be changed. Okay? And drugs can change signaling. Environment can change signaling. If you go to church and you sing Amazing Grace, what happens is your brain goes in a meditative state because the music notes puts you in a meditative state. You start juggling. When you juggle, you cannot think of anything else. Your right brain, left brain coordinates. And you get the same meditative system. So a lot of these things affect us. You don't need to go and pay a lot of money to do this. Things you can tell your patients. Breathing. Simple breathing exercises. There's now apps everywhere. There's 6, 7 apps, I think, out there on breathing exercises. It'll even tell you, take a deep breath, 1, 2, 3, hold, now exhale. You keep doing that for 3 minutes, 3 times a day. Your cortisol goes down. Your stress level goes down. Simple things we can do. Those are all signaling. What you're doing is you're self-signaling your body and teaching you to calm down. It's like patting a baby or giving a massage. You're taking breathing, in, out, that's calming you down. Okay, they're all medicine. Actually, much more potent medicine, getting a Valium. And not that sometimes, you know, you need Valium, but you don't need it all the time. Okay. Information scarcity. In spite of all that, we have a lot of data but lack of information. For example, when somebody comes to you and they say, my cholesterol is very high, what does it mean? The first thing would be, oh, we need to put you on Lipitor. But do you? What happens when the cholesterol really goes down? When cholesterol is below 150, the rate of Alzheimer's disease and dementia increases. So you've got your cholesterol under control, but you're going to get demented. Pick up the Vioxx Celebrex. Vioxx and Celebrex, in my opinion, are some of the best drugs the market made. But you took too much of it for too long, your arthritis was gone, but you died of a heart attack. There's a side effect, okay? Because you have inflammation going on, you block it, it goes somewhere else. The body always adapts, goes somewhere else. Okay. So we're dealing with information pollution. What we need to give this is context. That's what this lecture is going to move towards. Networking. Networking is an important way to give context. Nursing. You guys are trained to network with everybody in the hospital, from housekeeping to pharmacist to the physicians, the physician assistant, and a lot of the time you have to learn diplomacy. And a lot of things, most of you, if you're in a family, most families is dysfunctional. That's a definition of family. So you know how to deal with the dysfunction. So you've got to be able to deal with this dysfunction and have a thick skin. Networking. That will give you context because it makes you understand different people, different point of view. And your patient is the center of it. Systems biology is basically, it's just not your electrolyte, just not your blood sugar, it's just not your cholesterol, it's what's your hormone, what else is happening. You're trying to bring all the things together. And I've been out of, in the nursing industry for about 15 years now. But even then, they were coming up with great forms, actually I think too many forms, but giving you an idea how to integrate care. And that's a form of a system. And it's important for you to learn it, even though it looks like all paperwork. If you get good at it, afterwards you can go through the paperwork very easily and get a good idea of what your patient is about. Then when you walk out, you're going to feel good. Or you're going to walk out feeling depressed and saying, what am I doing here? Okay. Ecological perspective. What's the difference between environment and ecological? Environment is whatever is there, you want to keep it exactly as is. Ecology means things are changing and you learn to adapt to the change. So in society, species die out. That's part of ecology. New species come into being. Today on the news there was something about lice. I don't know how many of you saw it. The lice is becoming a big thing in schools again, because the lice have adapted. There's a triple mutation, and the drugs don't work on them anymore.
Oh, great.
Okay, but that's ecology. You start throwing things at them, other side will adapt. So you've got super lice. So maybe you've got to go back to the old-fashioned idea of using the comb, spending the time, and killing them one at a time. Which is what people do, which actually is great. You spend 45 minutes with your child doing hair care, talking them, touch therapy, everything else. Ecology, things change, you want to adapt. Not just go with, we need a newer drug. Okay. Now, this is a big thing. I'm going to move faster. This is called Human Microbiome Project. I would advise all of you to go look it up. Okay, YouTube is plenty of them. This is probably the greatest adventure humanity has undertaken since the genomic project. What does that mean? Now, human beings, when we look at it, we think of ourselves top of the pyramid. But really, when you look at it, human beings, we have 23,000 genes. That's all. At one point, we thought we had 100,000 genes. Then it became 50,000 genes. Now it's 23. The bacteria in your body has over 1 million genes. Right. If I took any one of you and took you cell by cell apart, 90% of your cells are bacterial. Only 10% is human. So you could make a case, all you are is a mobile petri dish carrying around all these bacteria. Okay. And now what we're doing is we're actually studying them. So what we're talking about on the body, or 1 trillion organisms are in our body. Okay. Well, right now, we have figured out not 500, this actually now it's jumped from 500, 700 species. 90% of cells in the body. So that's amazing. So all the genes are also interacting with us. So depending upon what kind of microbes we have on us, they influence us. Yeah. This just shows microbiome again. All these species, they're mapping all this. So they're mapping using genomics. And what we're finding out is that even on the nose, certain bacteria is up here, certain bacteria is up here. It's like Norfolk. If somebody says, hey, tell me about what kind of people live in Norfolk. You can't, because different Actually, different areas have completely different people. The body is the same way. What's on your eye, what's in your face, they're all different bacteria. They'll colonize and they all affect us. The gut is extremely populated. Now look at a girl, look at a child who's 2 years old, has to go to kindergarten. What does he or she do? Starts crying, has stomach pain. They didn't learn that behavior because when the body gets anxious, it affects the gut. The gut microbes in turn send signals to the brain and you get stomach pain. What do you do when you're nervous, when you're in love? Your butterflies in your stomach. What's that got to do with it? It's a brain, but it's affecting the gut, right? Or if you go into to a talk and you're nervous, you feel nauseous. What's that got to do with anything? It's that. When you blush, what happens? Your blush marks come up, but it's got nothing to do with it. It's a brain. Things are all connected. Everything is connected to everything else. Okay. This card, let's go. Now, this is an old slide from 15 years ago. And at that time itself, you knew 1 gram of stool has 150 times more bacteria than people on the planet. 1 gram. And 60 to 70% of all the immune system is in the gut. Okay. And there's 100 million neurons in the gut. So the gut, next to the brain, the gut has the most neurons. That's why everything, if you're nervous, you get diarrhea, you get irritable bowel, everything else. So here when you look at that, the microbiome affects everything. It affects the immune system, circulation, your gut, your brain, your behavior. For example, people who have had severe psychotic breakdowns and multiple medications for suicidal, almost comatose in the hospital, they've done fecal transplants. Literally, poop from one person, put in another person. Other than 6-7 hours, that person is getting up and the mental problems are disappearing. Really? So what we're realizing is that microbe affects the brain. And so what that brings the question, what we eat, what we do, has a direct effect of who we are going to be. And that's a lot of research. That's why I tell all of you, read up on microbiome. It's a fascinating subject. Okay. So what makes us human? Our genome, or the person walking around? Is it all the bacteria in us? Is that what makes us human? Is it biofilm? Biofilm are films on our skin and everything else. They interact with us. For example, when you go out, certain people, mosquitoes attack you. Why? Because depending on what kind of bugs on your skin and what kind of oil you produce, I can attract mosquitoes or not attract mosquitoes. Some people go out, ticks can come on them, they don't want to eat them because the skin doesn't taste good or the oil in there is repulsed them. So human beings, depending upon what kind of an armor we have, we can walk in the world and survive. What do most of us do? First thing in the morning, we get up, take a hot shower, scrub the skin, get rid of all the oil, put a big sign in the back of us, kick me, and you walk out. And wonder why things go wrong. Okay? Signaling. Remember I said one of my big topics, signaling. That's a baby being born or baby fetal development. Think about the amazing thing, 2 cells coming together to form a full human being. If you looked at an OBG and you looked at ultrasound, everything else, it's amazing. But it is very fragile. How many of you remember thalidomide babies? Only one?
Well, I heard about it in class.
Okay. What thalidomide babies? It's a drug which was given, which is supposed to be the safest drug in the world. What it did was, it interfered epigenetically so you didn't grow your arm. A signal stopped it. So, same thing for folic acid. Actually, it should be folinic acid. Folic, let's say, used for discussion of folic acid. Why did we give folic acid for mothers? Because folic acid acts to make sure that your nervous system develops properly. What's folic acid? Leafy vegetables. That's all. Okay? So there are things which we eat directly affect who we are, how they signal it. Okay, if they don't, if the signal is lacking, that part of the body doesn't grow. It's like children. If you don't teach them all the right thing, then you can't blame them. They are going to be what they are. Okay. Now, simple thing on just another thing, female on brain pet. Until 8 years old, every fetal brain is female. Doesn't matter. At 8 years old, what happens? The Y chromosome produces fetal testicles. Then what happens? It produces testosterone. What does the testosterone do? It kills off communication centers rapidly and grows more sex and aggressive centers. This permanently changes the male brain. That's why men have 2.5 times more brain space devoted to sexual drive and aggression.
Oh, really?
Okay.
Okay.
So, I mean, that is testosterone.
Yeah, it is.
Okay. So that's why when in kindergarten, what happens? When the boy likes a girl, he goes pulls her hair. Because his communication center to interrelate is defective. It's compromised. The girl wants to talk, communicate, network. The boy doesn't know. The aggression is faster to get attention. But this is just one point I'm making to show all the hormones in your body, they all play a part in our behavior and how our brain functions. So if you don't have, right now for example, a lot of girls, 12 years old, 10 years old, are fully developed, have a size 36 breast. Why? Because a lot of them, these chemicals, estrogen mimics, are in the system, it's accelerating them. But when you accelerate something, that means they haven't had time to adapt, then more problems are going to come. Those are epigenetic things, damages from the outside. And we know some of the damages done goes up to 3 generations. Okay, it just doesn't stop in 1 generation. Things like insulin, things like HCG, oxytocin. Oxytocin, how many of you know oxytocin? Oxytocin is what happens when you hug somebody. When you hear every time that, once a year at least, some woman kills a baby when it's born. And you think, oh, she's such a horrible person. What happens when you think about it? I've got 2 girls, they're wonderful. But when the baby is born, the baby is a parasite. It's your parasite, but it's a parasite. It's sucking the mother, taking all the things. But when what happens, the baby is born, there's a huge oxytocin surge, which makes you love your child. And so you can tolerate everything else. All of a sudden from pain, you're so happy. If your oxytocin surge happens, then you're seeing this thing, this animal attacking you, and you kill it. Oxytocin also can deplete as we grow up. If you don't have enough hugs, if you don't really have contacts, if you don't cuddle, all those things are depleted. So what happens? You withdraw. A lot of men do that because, one, they're not good at communicating, and there's not ever hugging. Sex just is a fast thing, it doesn't really build that much oxytocin. Sex builds more oxytocin in women, but not men. Okay. So this affects, like some of our patients, we actually give them oxytocin because they can't break out. They've got a barrier. They just can't do it. Okay. Dopamine, serotonin, phenylalanine, they are neurotransmitters. What you eat can affect the neurotransmitters. Like niacin. If you give a lot of niacin to somebody who's really already agitated, you will agitate them even more. Okay. Things like the school killing, the 50s for 25 years. What we found out, most of them were they were good kids who had depression, who were put on SSRIs, which has a warning label in young men with SSRIs, can become homicidal and suicidal. So now there's a lot of work in screening this. SSRIs are great drugs, but the subpopulation, it's deadly. Okay, so what we are learning in the 21st century, realizing all these things of the 20th century, all these miracles have their darker side. And we need to acknowledge both. We need to be more mindful. We need to give it context. Okay. Melatonin is another big thing. Without melatonin, life couldn't exist. Every living creature on the planet has melatonin. And melatonin is involved in a great many things, including antioxidants, anti-inflammatory, anti-hypertensive, brain health, all of them. Why, for example, nurses who are on night shifts have been shown in big studies to have a higher cancer rate than breast cancer. Okay. But does that mean you shouldn't do night shift? What you need to do, that means when you come home after your night shift, take some melatonin, keep the room perfectly dark, and set up. So we are human beings. We can adapt to anything. But we need to choose. We need to make wise decisions. Okay. This is how the biology is. You're always in motion. The body, internal, external. But this is how, oops, that's how most of us are, ready to fall off. Okay. To get to be dynamic, you have to understand endocrine disruptors, toxic metals, psychosocial problems like touch. Are you getting enough touch? Are you getting hugs? Are you doing that? Celebrating together with people. They're all important points. Light. If you don't get enough melatonin, when you need light in the morning, but at night you need total darkness. All these things play a part. Genomics, or we call nutrigenomics. Nutrigenomics is a field. This all of you most probably would say, what diet should I be on? There's many diets, but the more diets that are out there, the more obese people are. So there's something wrong. You can look at your genetic profile and tell what was your genes made for. Were you made for low-fat diet? Were you made for high-fat diet? Were you made for Mediterranean diet? We can delineate genetically. That's something we do a lot in our office. And we can also tell what vitamins you need to take, what you don't. What we're learning is taking too much vitamin is actually bad for you. So we are used to the idea of 1-a-day pill, because if not, patients won't know. They won't take it, they're compliant. But really, if you're doing much workload, if you're going exercise or running a marathon, your need for vitamins and everything goes up. But after the marathon, after a couple of days of the marathon, you don't need to take all the vitamins. You can cut it down by half. Or if it's a winter day, you're sitting down, your fruits, you're watching TV, doing nothing, you may not need any vitamins. But to know that, you need to know what your genetics are. Okay. Rainbow copycat. This is basically, they clone this cat. But when you clone a cat, what happens? That cat doesn't look like the cloned cat at all. Why? Because when you clone something, as that develops, the environmental influence acts on the gene, acts on the DNA. Some are shut off, some are open, so it comes different. What I'm trying to tell in personalized medicine, every one of it is different. This idea we do in public health of everything for one person, is not a good one, but it's the best we have. But for nursing, doctors, nursing, and since nursing, I'm saying, you guys should be able to say, you're unique. You know what, I know the doctor, you try it out. If it doesn't work, maybe something else is wrong. Make a log of it. With all these things in YouTubes, look up something and show them, hey, maybe want to look at this. Because most patients sitting down doing nothing anyway. Okay, and everybody seems to have a pad these days. And everybody seems to know how to use it better than I do. So what is epigenetics? Epigenetics, exercise influences your genes. Nutritional factors and what kind of food you take influence the genes. So everything you can think of, they all influence who you are. And not to forget, your microbiome and the microbes on your body. Right? Just taking probiotics may not do the trick. Because what are probiotics? Probiotics are bugs which we can grow in abundant quantity and sell it for a cheaper price. But most of the bugs in our gut, we can't even grow them. We just know the genetic markers. So if you're going to eat something, you should be eating more fermented food. You know, those of you like the food, if you like island food, Thai food, kimchi, different things, you need to use all that. The more you have, the better colonization you have. What the body's ecology needs is a mongrel population, which is what the Americans are. Every different kind you need to have. If the population becomes monoclonal, any one population predominant, then you have a problem. Okay? That's a simple way of putting it in. Now, food. If you look up epigenetics, you're going to come up with DNA methylation, histone modification. I can't go into that, but basically methylation is how a body cleans the garbage from the body. That's why you take folate acid. That's why you take leafy green vegetables. Okay. And by knowing what your genetics are, we can actually tell you what foods you should be eating more of. Okay. This is a new science, and it's real science. Unfortunately, it's not. It's slowly being taught in medical school, but you guys can go on the internet, look it up, educate yourself. Okay? So really, to put this out, the 21st century medicine is a medicine, ecological medicine, personalized medicine, which means a human being is not an island unto himself. That human being interacts with each other. You interact with the environment. We're sitting in here with air conditioning, right? And that affects what we're doing. You go outside, you're sweating. That affects what we're doing. Now the air conditioning system has some water accumulated. You could get Legionella disease. Everything affects everything, including how we think. What we think, what we do. Human beings are creatures who can self-reprogram. We can rewire ourselves. Or we can sit back and let other people wire us. It's like having these keyboards. We are born, we have all these keyboards. Everybody's programming us. But at some point, you got to take those programs back and reprogram yourself. And there are many ways to do it. You do not have a PhD, anything else. One thing about 21st century is it's giving you access to information, data, to think. Only rule number one, some of the rules I would say is if something is too good to be true, probably is. So look back, be skeptical. And if somebody says, I'm here to help you, think twice. Or if they're giving you a data and they're making it confusing, that's all. If people can't convince you of something, they confuse you with a lot of data. So start getting used to it. It takes a few years. But if you start questioning things, looking for answer, not go for easy answer, you're going to make great nurses and you'll make huge impact in your patients' lives. And the life of the physicians who actually, the better job you do, you make them look good.
That's right.